Dear ladies and gentlemen, we would like to introduce you the presentation of our research. The topic of our research is Geography of the COVID-19 pandemic in Ukraine and the world, Similarities and Differences. The COVID-19 pandemic will go down in the history of humanity as one of the most important events of the first quarter of the 21st century. It has caused unprecedented consequences in both political and socioeconomic spheres of all countries. The result of that, the scientific community is widely interested in addressing absolutely all aspects of the pandemic. The researchers used a wide range of geospatial and statistical software, and the examples of them were clustering, hotspot analysis, spatiotemporal scan statistics, and regression modeling. Such studies allow developing territorial forecast models of the pandemic, creating various medical and cartographic materials, the examples of which you can see in the breaks. The purpose of the research is to conduct a geospatial analysis of the spread of COVID-19 in Ukraine and the world, identifying similarities and differences. The work is based on the synthesis of monitoring and geoinformation approaches to the study of a new coronavirus infection, and the quantum geoinformation application was used as geoinformation platform. The COVID-19 coronavirus pandemic has been going on for over 3 years. During this time, it has spread all over the world, and with more than 765 million cases of infected people recorded, according to official data, and the disease has taken millions of lives. In Ukraine, the first case of COVID-19 coronavirus infection was confirmed on March 3 of 2020, and the patient arrived in Chernivtsi from Italy, where he had been traveling from February 21st till February 26th. Later cases of infection were detected in Khmelnytsky, Odessa, Donetsk, Kharkiv, Zaporizhia, Kherson, and Vinnytsia regions. Epidemiologists call the first patients people who returned from foreigner trips, where they could have got COVID-19. For instance, patients in the eastern regions returned from Egypt and Europe, particularly France. In the western, from Austria, Hungary, and Italy. In southern regions, from United Arab Emirates, Egypt, the United States, and European countries. The mechanism of the virus infection in Ukraine is similar to the global one, from the primary source to the chain of contacts with the infected. However, due to the lack of direct flights to Wuhan, China, Ukraine received the virus after its long transit through other countries, which is almost 2 months later than countries in Asia, Europe, and America. This temporal discrepancy has been observed throughout the pandemic. This conclusion is best illustrated in figure, which shows the temporal correlation between the waves of disease development in the world and Ukraine. From this graph, we can identify 4 waves in the development of the disease, both globally and in Ukraine. The figure shows a horopleth map of the distribution of number of detected cases of COVID-19 infection and the world in the end of the pandemic. At the end of the pandemic, according to World Health Organization, the 5 countries most affected by coronavirus infection were the United States, India, France, Germany, and Brazil. If we analyze the quantitative composition of the 30 countries with the highest incidence rates, most of them are from Europe and Asia. In terms of the absolute number of cases, the countries with largest populations are leading the way. Only African countries are absent from this ranking. It is worth noting that, for the most part, regional patterns of the pandemic, both at the country level and the larger scale, are almost identical. The development of the pandemic in Ukraine is an example of this. Thus, the spatial differentiation of number of detected cases of COVID-19 infection in Ukraine at the end of the pandemic generally corresponds to distribution of the population by regions of the country in the pre-war period. The regions with the largest population have the highest number of cases, and the smallest have the fewest cases, respectively. At the same time, the nature of the histogram showing the temporal change in the number of confirmed cases of infection is almost identical for all regions of Ukraine and differs only in absolute terms of the pandemic. However, from the February of 2022, Ukraine experienced quite big migration processes from the war zones due to Russia's military aggression. Also, parts of the country's territory was and is under occupation. Therefore, if we analyze the map of the distribution of number of detected cases of COVID-19 to the number of people, we can clearly see the zonal distribution of this indicator. Its value increases in the direction of south-north and east-west. This spatial differentiation is explained by migration processes, and the number of people and accordingly the number of COVID-19 cases in the northern and western regions has increased significantly due to migration from frontline areas to the south and east areas of Ukraine. The main consequence of coronavirus is sharp increase in mortality, in global mortality. At least 7 million people have died during the coronavirus pandemic, even though the researchers believe that the number is quite much bigger and reaches around 20 million people. The coroplast map of coronavirus deaths actually duplicates the map of the spread of the infection in the world. The main reason for this is the close correlation between the total number of infected and deaths. The correlation coefficient is plus 0.88, but there are exceptions. The map showing the spatial differentiation of mortality from COVID-19 looks radically different. This indicator shows the number of deaths from the coronavirus relative to the total number of patients from the pandemic for each country. In fact, this indicator demonstrates the effectiveness and the accessibility of social security and healthcare system in the countries around the world. So the average death rate from COVID in the world was like 0.99%, and most countries in Africa and Latin America had the highest mortality rate, until 7%. As of 29th of June of 2023, the coronavirus mortality rate in Ukraine averaged 2.02%, and it's twice the global rate. The highest mortality rate from coronavirus were recorded in Kirovograd, Luhansk, and Dnipro regions. The lowest rate were recorded in Rivne, Ternopil, and Volyn regions. As a result, there is a pronounced spatial differentiation of COVID-19 mortality rates on the map of Ukraine. The southern and eastern parts of the country have the highest mortality rate, which is over 2.3%, and the northern and northwestern parts have the lowest, which is less than 1.7%. According to the quantitative characteristic of two main indicators of epidemiological course of COVID-19, which is detected cases and mortality, all regions except the Autonomous Republic of Crimea can be divided into 4 groups. The first group includes Zakarpattia, Chernihiv, Kirovograd, Kherson, and Luhansk region. This region had the lowest number of patients with coronavirus infection, which is less than 150,000 people, and we have an above average mortality rate, which is 2%. They have low population density, they have demonstrated some difficulties in the healthcare system, ability, and etc. The group 2 includes Sumy and Cherkasy region, and most regions in the western part of Ukraine, such as Volyn, Rivne, Zhytomyr, Ivano-Frankivsk, and etc. They have the lowest mortality rate, 2%, with average number of detected cases from 150 to 250,000. These are regions with the best epidemiological situation of the pandemic. Third group consists of Chernivtsi, Vinnytsia, Mykolaiv, Poltava, Zaporizhia, and Donetsk regions. The mortality rate there about 2%, and average number of detected cases is from 150 to 250,000. The group 4 consists of Kharkiv, Dnipro, Kyiv, and Lviv regions, and these are regions with the highest mortality, 2%, and morbidity 250,000 in Ukraine. The course of the pandemic in Odessa region should be noted separately, because with the largest amount of detected cases, which is almost 360,000, the mortality rate in the region was recorded at 1.74%. And this can be explained by the most favorable climatic and environmental conditions in the regions. Based on the results of geospatial analysis, although geographical map of Ukraine zone according to the epidemiological course of the COVID-19 was constructed, and it reflects the spatial differentiation of the pandemic parameters, which is associated with various and multi-directional factors that determine the course of the pandemic. And the main ones of them: A, population density, regions with the highest population have the highest morbidity and mortality rates. B, spatial mobility of the population, external and internal migration of the population, which made a big impact on the spread. And C, the peculiarities of regional management. So the development of the situation was quite much dependent on the quality of management decision made by regional and city authorities.